I was attracted to medicine by my exposure to a family practice doctor in my hometown who was a friend of our family. And I went off to school thinking that I would probably be a family practitioner, but I became much more interested in the surgical specialty. So I began undergraduate training in 1971, and then in 1974 I finished college and started medical school. I became board certified in 1989. The American Board of Plastic Surgery is the board that is sort of the gold standard for plastic surgeons. It's the board that's approved by the American College of Graduate Medical Education, which is sort of the overbody that supervises and makes sure that the board certifications meet a certain standard. So having cleared all of those goals, I have then been in private practice in one form or another, either in group or solo since that time. And as my practice has matured, I've moved more toward cosmetic surgery. And among those things, one of my favorite procedures to do is liposuction. It's widely practiced and it's very effective and a fun procedure to do. The consultation is an opportunity for us to get to know each other. And it's really, we get first impressions, but we also get a chance to delve into motivations and qualifications and so forth. So the patient's getting to know me, I'm getting to know the patient, and it's at that point that we decide if we fit together. The typical liposuction patient who comes in is generally female. There are a fair number of males who come in as well, but the females are, I think, more tuned into their body image and more accepting of the concept of changing it. They typically want to know if they're a good candidate for the procedure, and we go through a process of discussion of whether their skin has enough elasticity to snap back after we take the fat out from under the skin, whether the fat is in the right position. If there's fat just under the skin, it's perfect. If the fat is deep inside the body, inside the muscles, inside the abdomen, then we can't approach it that way. So we have to sort of clarify what's appropriate for them. They want to know if it's going to be a durable result. Is this something I have to do repeatedly? Am I going to have to come back over and over again to do this, or can I just do this once and expect a long-lasting result? And of course, part of that responsibility is mine. I have to do a good job for them. Part of their responsibility is theirs. They have to take care of themselves after the operation.